here we are. So good morning. I am Dr. Cheryl Loken from the state of Wisconsin within the United States of America, and I'll be discussing gastrointestinal diseases of cats today. As we go through the presentation, I recommend that you write down your questions that you have, and I will be happy to address those that I can at the end of the presentation. At that time, you will be welcome to unmute your audio and ask your question, or you can also put it in the chat box. The PowerPoint slides will be made available to you on the VetNet website. So the hallmark of gastrointestinal disease is vomiting and diarrhea, either one or both of these. However, there are extra gastrointestinal diseases that can also cause these signs. So our job is to consider all the different things that can cause vomiting and diarrhea and begin to narrow the list by performing key diagnostic tests. In our efforts to do that, we will specifically be looking at the signalment and history, the specific questions we can ask the owner to help us narrow down our list of potential diagnoses. Then we'll look at how to characterize diarrhea and why that's important. We'll look at a list of differential diagnoses under both categories of extra gastrointestinal and gastrointestinal. Then I will just touch on a few points on the physical exam that can immediately help lead us to the best diagnostic tests. Then we will look at some specific diagnostic tests and the results that we can expect to see with the different diseases. And lastly, we'll look at treatments for select diseases. For the signalment in history, there are a few questions that are important to help narrow down our differential diagnosis list. The first is going to be the age of the cat. Younger cats are more likely to have vomiting from ingestion of a foreign body, such as a string, or Pan Leukopenia virus, whereas older cats are more likely to have vomiting and diarrhea from hyperthyroidism. Whether the cat is inside only or has access to outside will help us know if it's more likely to have parasites or access to toxic plants. Important questions about the cat's diet include what kind of food the cat is being fed. Is it being fed actually cat food or dog food? Is it good quality or poor quality? Have there been any changes in the diet? When was the current bag purchased? Is it an old bag that may have gone stale or moldy? Or is the person feeding the cat people food? As any change in diet can cause a food intolerance and can produce vomiting and diarrhea. If there has been any change in the diet and the cat is not seriously sick, treating symptomatically and with a good, consistent diet may be all that's needed. Is the cat catching prey? If so, has the cat been dewormed recently? Predation can cause parasitism and food intolerance. Has there been any exposure to toxins such as chemicals or plants? These can cause GI upset and also potentially harm the liver and the kidneys. Does the cat have a habit of chewing on and swallowing foreign objects, such as string? The two pictures here show a lily, a plant, which can cause kidney failure in cats that eat it, and a kitten playing with string, and strings are serious foreign bodies. Is the cat vomiting, or does it have diarrhea, or both? Vomiting is usually associated with primary GI diseases affecting the stomach and small intestines, whereas diarrhea can be from both diseases of the small and large intestines. Have the owner characterized the vomit and or diarrhea? What is the color, consistency, and timing in relation to eating? How long has this been going on? Is it been days, weeks, months, or even years? A foreign body will cause a more serious problem rapidly compared to a slowly developing neoplasia of the GI tract. How many times per day or week is it happening? And has the frequency or character changed over time? And lastly, are other cats or other pets showing similar signs, signaling something that might be contagious or that they have all been exposed to, such as food, chemicals, or plants? With the information that you obtain from the owner and possibly some basic blood work, you can characterize the diarrhea. First, you look at, is it acute or chronic? Acute being under 3 weeks and chronic being present for longer than that time. Is it non-serious or serious? With serious being over 10% loss of body weight, 3 to 5% dehydration, having hemorrhagic diarrhea, and electrolyte changes, or the cat's temperature being over 104 degrees Fahrenheit. Is the diarrhea originating from problems affecting the small or the large bowel, knowing that sometimes both can be affected? For acute, non-serious diarrhea, a lot of extra diagnostic tests may not be required, and you can treat symptomatic treatment first and monitor the response. This slide shows a treatment trial for acute non-serious vomiting and or diarrhea. Always start with deworming, even if a fecal is negative, as there can be false negatives if there is not active shedding of eggs. A good broad-spectrum dewormer is fenbendazole, which is effective against nematodes and giardia. The dose is 25 milligram per kilogram once a day for 5 days, and then repeating it in 2 to 3 weeks. Metronidazole is used in cases of diarrhea, as it is an anaerobic antimicrobial, antiprotozoal, and also has some anti-inflammatory properties. The dose here is 25 milligram per kilogram per day. Again, this is for diarrhea. Using a highly digestible diet is often key to quickly correcting vomiting and diarrhea. These diets also usually have increased B complex vitamins and potassium to help replace nutrients lost with diarrhea and vomiting. They have moderate levels of fat to ensure adequate nutrient intake with smaller portions of feed, and also contain a combination of soluble and insoluble fiber to help modify bowel transit time. For vomiting, an antiemetic such as meropetin at 2 milligram per kilogram once a day can be used. And for diarrhea, an antidiarrheal agent such as loperamide at the dose given, that can be used twice a day as needed. If the treatment trial is not effective, then it's time to move on to more diagnostic tests. Distinguishing between small bowel and large bowel diarrhea can help direct the direction of the diagnostics that we want to perform next. In small bowel diarrhea, the patient may have a mild increase in the frequency of bowel movements, but the volume each time is increased. Whereas with large bowel diarrhea, the frequency is much more frequent, with either a normal or even decreased amount passed each time. If blood is present with small bowel diarrhea, you will see digested blood or melena, whereas with large bowel diarrhea, there may be frank blood seen. Mucus is quite often seen with large bowel diarrhea, but not with small bowel diarrhea. The next two parameters are often seen together, namely straining and urgency. They are not typically seen with small bowel diarrhea, although sometimes there can be an increased urgency. In large bowel diarrhea, both straining and urgency are present. Weight loss is common with prolonged small bowel diarrhea, but only occasionally seen with large bowel diarrhea. This slide continues with other parameters comparing the areas of diarrhea. Both borborygmus and flatulence can be seen with small bowel diarrhea, but are not present with large bowel diarrhea. Affected small intestines can produce vomiting, but that's only infrequent with diseases of the large intestines. Appetite can be variable with small bowel disease, and there is usually no effect on appetite with large bowel disease. From a chemistry panel, there may be indications between the sections of intestines that is affected by disease. The three most commonly affected values are albumin, globulin, and cholesterol, which may be decreased with small bowel diarrhea. But these values also may be normal depending on the severity of the disease. For large bowel diarrhea, these values are not affected. Once you have established the signalment and history of the patient and characterized the diarrhea if present, then it's time to consider the differential diagnoses. These are divided into diseases that are not primarily affecting the GI tract, but through their disease processes can secondarily affect the GI tract. And then those that do primarily affect the GI tract. Oftentimes, these diseases can be diagnosed or ruled out by blood work and urinalysis. So for extra gastrointestinal diseases that can produce vomiting and/or diarrhea, the list includes renal failure, hyperthyroidism, hepatic disease, pancreatitis, complicated diabetes, neoplasia, and FIV and leukemia-related diseases. For primary gastrointestinal diseases, I've divided the list into two sections, describing if each will cause only vomiting or only diarrhea or a combination of both. The first 5 on the list can produce one or both vomiting and/or diarrhea. And the more severe and widespread the disease, the more likely that you will see both. They are parasites, food allergy or intolerance, inflammatory bowel disease, intestinal lymphoma or other GI neoplasia, and toxins. Things that cause vomiting but not diarrhea are gastric Helicobacter infection and obstruction, whether from a foreign body, neoplasia mass, intussusception, or a stricture. But it must be noted, however, that diarrhea is often the cause of an intussusception. And lastly, constipation can actually cause vomiting. Diseases that cause diarrhea, but usually not vomiting, include Salmonella and Campylobacter infections, Feline Pan Leukopenia infection, and Exocrine pancreatic insufficiency. The EPI is actually a primary problem with the pancreas, not producing enzymes to allow digestion of the food, so could be considered an extra gastrointestinal disease. I have included it in this list because the blood work done to help rule this disease in or out is very useful for other gastrointestinal diseases as well. Knowing all of these things that can cause vomiting and diarrhea, there are a few specific things on our physical exam that can single out specific differentials. For a cat with a history of vomiting and/or chewing on foreign objects, always look under the tongue to see if there's a string wrapped around the base of it. It's easy to do in most cats as you open the mouth and use one finger to push up between the mandibles of the jaw, and that will allow you to see the base of the tongue. With a string foreign body, many times you can actually see the string, as you can see here in the picture. Other times it may have been started to embed itself in the tongue and prevent good visualization of the base of the tongue, and would also cause pain during this procedure as well. While examining the head and neck area of the cat, especially in older cats, always palpate the thyroid. As you run both fingers along the trachea in a cranial to caudal direction, with an enlarged thyroid, you will feel it slip under your fingers. And then during abdominal palpation, you can be feeling for intestinal thickness, discrete masses, or even a palpable foreign body. If you are not familiar with these procedures, I would encourage you to practice them in every cat exam, so you become more familiar with what is normal versus abnormal. All right, now on to diagnostic testing. Which tests and how many you run will really be determined in each individual case by what your history and physical exam findings reveal. So the lists I have are pretty exhaustive, and not all of them will be done on every case. Other than a fecal test, testing for extra gastrointestinal diseases is usually easier, since many of them will be ruled in or out by the use of basic CBC and chemistry panel and a urinalysis. Since we are dealing with the feline species, it is always a good idea to run an FIV and leukemia test in every outside cat and inside cats that have not previously been tested. And there shows the results of the FELV positive test for the SNAP test that we have available here, produced by IDEX. After that, every chronic case and every acute case that does not respond to symptomatic treatment should have a CBC and a chemistry panel with added T4 and a urinalysis. For suspected pancreatitis, a feline pancreas-specific lipase, that's SPEC FPL, can be added. Beyond these tests, an ultrasound or radiographs may be necessary. Here I've listed some possible outcomes from testing with the list of extra gastrointestinal differentials. Note that not all of these occurs with every case. So with renal failure, there'll be a decreased urine-specific gravity, increased SDMA, creatinine, BUN, electrolyte disorders, and possibly anemia in more advanced renal failure. With hyperthyroidism, again, making sure that you palpate the thyroid area so that you can see if you can feel an enlarged thyroid. And then on the chemistry panel, you'll see an increase in the T4, or the total T4. And you also may see some increase in liver values, such as the ALT and ALK Phos. With hepatic disease, within the serum, you'll see an increase in the bilirubin, decrease in the BUN if the disease is pronounced enough that the liver can no longer make enough of the BUN, increased ALT, and the second one there is supposed to be ALK Phos, and then GGT is a very important one in cats. You'll see that raise. And then you can also see an increase in the bilirubin of the urine. Any bilirubin in the urine in cats is very specific for liver disease, unlike the dog, which sometimes you can see a little bit of bilirubin in the urine. For pancreatitis, you will see an increase in that FPL. You may also see some increases in the liver values, ALT and ALK Phos. On the CBC, you can see a leukocytosis and possibly an anemia. And then if you're able to do an ultrasound, you will see changes on that as well. With complicated diabetes, you'll obviously see an increase in the glucose within the serum and the urine both. And more prolonged cases, you can see ketones in the urine, and within the blood work, you'll see electrolyte disorders. For neoplasia, a lot of times you may be able to palpate these, or you'll be able to visualize those on radiographs or ultrasound. And then with the FIV and leukemia related diseases, obviously on that test that we looked at previously, the leukemia antigen spot would be positive, or the FIV antibody spot would be positive. All right, so moving on to gastrointestinal tests for actual gastrointestinal diseases. The first diagnostic for diarrhea is, again, that fecal flotation. and that will detect the most common parasites such as roundworms, hookworms, whipworms, and Coccidia. Now the next one I have on this list is Cryptosporidium, which is a Coccidia, but it's also so very small, so it's hard to be identified on a routine fecal flotation. So many times a fecal may need to be sent off to a lab to find the Cryptosporidium and or the Giardia. Fecal culture can be taken from a fecal sample sent to a lab to look for such agents as Salmonella and Campylobacter. And this is not an exhaustive list, but those are two that are more common. In a kitten with bloody diarrhea and dehydration, a Feline Pan Leukopenia test along with a CBC can be run, as that is similar to the parvovirus disease in dogs. That virus attacks rapidly growing cells, so both the intestinal lumen cells and the bone marrow cells are affected by that. If fecal tests and blood work have been normal to this point and the cat has chronic diarrhea, an elimination diet trial may be performed to look for food allergy. Sometimes with allergies, you can also see a high level of eosinophils within the blood work, and often you'll see allergic skin reactions as well. There are two types of diets used for this. The first is a hydrolyzed diet, which breaks down the proteins to such a small size that the body does not recognize them as foreign proteins. And the other is a novel protein diet, which includes a simple protein and carbohydrate source to which the cat most likely has not been exposed to before, such as venison and green pea, or ostrich and sweet potato. It is important to go with a prescription type diet, as commercial diets may not always contain only the ingredients on the label, as they may contain contaminants. For exocrine pancreatic insufficiency, that is very rare in the cat, but blood work should be done to help rule this out. And along with the trypsin-like immunoreactivity, or TLI, a GI panel also measures the cobalamin and folate levels. These can be decreased because of inadequate absorption from the intestines and are useful in helping with treatments. Radiographs, with or without a barium contrast, can be useful to identify foreign bodies or discrete masses. The radiograph on this slide shows a barium contrast done on a cat with a string foreign body, and you can see the loops of bowels in a pleated or gathered formation. An endoscope can be used to detect and possibly remove a gastric foreign body, and can also be used for gastric and upper duodenal biopsies, although only superficial. That can be helpful to detect Helicobacter of the stomach. Gastrointestinal biopsies are needed to distinguish between inflammatory bowel disease and lymphoma or other neoplasia, although small cell lymphoma is a more common type of neoplasia we've seen, and it is something that we can treat. As stated previously, an endoscope can be used for superficial biopsies of the stomach and proximal duodenum, but can miss deeper disease. And obviously then you would not be able to get the other sections of the GI tract biopsy. So surgical full thickness biopsies are recommended. A biopsy of the stomach, and then 2 biopsies of each of the 3 sections of the small intestine, the duodenum, the jejunum, and ileum, need to be obtained. The last thing we're going to look at today is select treatment. I've included many gastrointestinal diseases, but it is not an exhaustive list. Again, the first treatment is always to deworm, even if the fecal flotation is negative, as worm egg shedding can vary. For common nematodes such as hookworms and roundworms, along with the stomach worm Physoloptera, You can use fenbendazole and pyrantel pamoate. Both of these treatments should be repeated in 2 to 3 weeks. And I've given you a dose there. And again, these slides will be available for you to return to on the VetNet website. For Coccidia, sulfadimethoxine is effective if used for at least 2 to 3 weeks. The goal here is to treat for 1 week and then retest a fecal every week until you get 2 negative fecals. For Cryptosporidium, again, even though this is a coccidia, it is harder to treat, but can be susceptible to Tylen, given twice a day there. For Giardia, either fenbendazole or metronidazole can be used, given once a day for 5 days. Salmonella and Campylobacter are both susceptible to enrofloxacin, and each of these bacteria are also sensitive to other antibiotics. But enrofloxacin does need to be used with caution in cats, as it can affect the retina. For Helicobacter of the stomach, a 3-week treatment period is recommended and consists of 3 different medications. The first is going to be an antacid, like famotidine, given at that dose given twice a day, and then 2 of the following, either amoxicillin, bismuth subsalicylate, doxycycline, or metronidazole. Again, the antacid and any 2 from that other list for 3 weeks. Food allergies, oops, there we go. For feline pan leukopenia, this is a very contagious virus, so you'll need to treat them in isolation and giving IV fluids to help with the dehydration that they get from the pronounced diarrhea. Also getting them on a broad spectrum antibiotic to help with any secondary infections from a devitalized GI tract. And using a highly digestible diet in these cases can also be helpful. For food allergies, they're treated with either that hydrolyzed or novel protein diet and nothing else. This needs to be stressed to the owner, as supplementing the diet or giving treats that are not complementary to the hypoallergenic diet will cause continued GI problems. Exocrine pancreatic insufficiency is rare, but if it is something that is diagnosed, there are pancreatic enzymes that you give along with the food. Usually they are fed at least 2 times a day, and that enzyme is mixed with the food and allowed to sit for 10 minutes to start getting the digestion going before feeding that to the cat. And then a lot of times cobalamin will need to be supplemented, as they will be low in that. A diagnosis of foreign body either requires removal by endoscopy or abdominal surgery. If there is a string foreign body, you want to make sure you cut that tongue under cut the string under the tongue if that is present. For inflammatory bowel disease, using a diet as for allergy can help, along with using immunosuppressive doses of prednisolone, which can be weaned over time to a maintenance level at the lowest effective dose that keeps their diarrhea under control. If an immediate response is not seen, then injectable dexamethasone may be needed initially if the intestines are not sufficiently absorbing the oral prednisolone. Again, cobalamin levels may be decreased with IBD, so supplementation involves giving weekly injections of vitamin B12 for 6 weeks, and then retesting the blood work to see if that has been, if they have responded, and if that can be discontinued at that time. And the dose there is a 250 micrograms under the skin, again, weekly for 6 weeks. The final disease that I'm going to touch on for treatment is intestinal small cell lymphoma. It is a treatable form of cancer that can be treated with oral medications, and the cats can live for several years with treatment. My drug of choice is cyclophosphamide. It is given orally every 3 weeks for the life of the cat. It can cause some myelosuppression, so a CBC should be run before each dose is given for the first 3 times it's given. If that has been normal, then the time in between CBCs being run is extended gradually until you reach a point of every 6 to 12 months. It is supplemented with prednisolone, giving half of a 5 milligram tablet every other day. And like with IBD, many times the cobalamin level may be low, and supplement is indicated at that 250 microgram dose under the skin every 6 weeks, and then retesting. All right, so that is my presentation for today. And I would ask if you have any questions. Again, you can either unmute yourself and ask your question, or if you want to put it in the chat box.
Yeah, this is the time for us. As a participant, I could see people from various parts of the India, not only India, from neighboring countries. That's one question is there.
Okay, so treatment difference for small intestinal versus large intestinal diarrhea. Again, it will depend on your final diagnosis, but this will help you to know whether you're looking at diseases that are more with your small intestine versus large intestine. Like your Salmonella and Campylobacter are more likely to be involved with large intestinal diarrhea. So you'll be more likely to run a fecal culture on those cats than the ones with small intestinal diarrhea. Whereas the small intestinal diarrhea ones, then you would know if you needed to do a biopsy, you would be doing the biopsies of the small intestine instead of the colon. Thank you for all the kind comments. I appreciate that. Any other questions? Okay, the hydrolyzed diet. What this does, it doesn't remove the specific proteins that the cat might be allergic to, but what hydrolyzed means is that it's broken down to such a small size. Like albumin is a larger protein, and these hydrolyzed diets are broken down into smaller particles than like what albumin would be, so that it's so small that the body doesn't recognize it. Oh, anything about drug-induced gastritis? Yeah, that drugs certainly can cause some gastritis. So usually if a drug has been given on an empty stomach, the first thing we would do would be to have them try giving that with food and or water, or actually giving an antiemetic beforehand, such as meropetent, to help with that. Okay, there's a question on here, dicyclamine. I'm not familiar with that. We have a doxycycline, that certainly is used in cats, but dicyclamine, I'm not familiar with that.
Dr. Cheryl?
Yes.
How about using ivermectin?
Ivermectin can be used. Here in the United States, it's not FDA approved, so it is better to use the ones here that are approved by our federal government, but it can be used because we have used that also for like treatment of skin mites. But
Thank
you do
you.
also have to be, you bet, you do also have to be careful with some toxicity there.
Okay, thank you.
Yes. Okay, let's see. Any way to diagnose small cell lymphoma if we do not have an endoscopic facility? Actually, to diagnose a small cell lymphoma, it's better to do the full thickness surgical biopsies because the endoscopic biopsies a lot of time will miss that. So anyone who can go in to do surgery for a SPAY can do full thickness GI biopsies. And again, you want to get one biopsy source from the stomach and then 2 from each of the 3 sections of the small intestine, the duodenum, ileum, and the jejunum. IV fluid doses. It'll depend on the percent of dehydration that a cat has, but even like a good surgical dose for a cat would be like 5 milligram or milliliter per kilogram per hour for a surgical dose. Again, for IV fluids, it depends on the amount of dehydration that you have to go by. And as far as types of IV fluids, either lactated ringers, if they do not have liver disease, you want to stay away from lactated ringers if there is any liver disease, as that needs to be broken down by the liver. And then also normal saline is a good fluid. Probiotics and prebiotics, yes, and I should have included that in my topic, but there's only so many things I can add. But yes, those are excellent ideas. I would use those. If the cat is receiving any antibiotics, you want to make sure that that is separated from the probiotics, as the antibiotics will kill the good bacteria as well. But yeah, that's an excellent idea to renormalize the healthy bacterial population. Okay, any other questions?
You can ask all your questions, or you want to add anything, you can add. You're most welcome to add also. As Dr. Cheryl mentioned that this presentation will be, yeah, some questions are there.
Okay, any sedative used for better examination? If you do have a cat that is a little hard to examine, then I would like to use gabapentin. You can give 100 milligram capsule like the night before and also the morning of, if you know that, that it is a difficult patient to examine and the owner is able to do that. Otherwise, if you're doing it in the clinic, you can give some butorphanol to help calm them down. Oh, let's see. Is hypothermia common in diarrhea? About the only time I would see that would be with like a kitten that has the pan leukopenia, where they are getting very dehydrated and they do have a lot of a lot of diarrhea. Then they can have a problem with hypothermia, especially being kittens. They can't regulate their body temperatures as well. So that would be another important part of the treatment there, along with the IV fluids and antibiotics, is warming. Okay, any change in the normal diet of cats during gastrointestinal diseases? Yes, that real GI-friendly diet that's highly digestible. We usually put our vomiting and diarrhea cats on that because it's less stress for the GI tract. Sometimes if people can't afford a prescription diet, then we'll say boil some rice and some chicken and use that, as it's very highly digestible.
You can keep on posting your questions in the. There's one more question.
Okay, occurrence of bloat. It really wouldn't be like you see bloat within cattle from grain overload or anything like that. If anything, if there's an obstruction, you may see that, or more likely you'd have a distended abdomen from something else like ascites from either liver disease or heart disease or cancer. Chronic kidney disease does induce vomiting, especially if it's later. So that is one of those extra gastrointestinal diseases that we need to rule out. And that's pretty easy to do with CBC chemistry panel and a urinalysis, because they will have decreased urine-specific gravity and increased SDMA, BUN, and creatinine. A dewormer for tapeworms. Praziquantel is a good dewormer for tapeworms. What we have here in the United States that has that added to it is called Drontal, but yeah, it's a praziquantel for tapeworms. All right, treatment for constipation. Yep, now we're going the other direction. Instead of diarrhea for constipation, you definitely want to make sure that they are well hydrated, especially in cats with chronic kidney disease, because as they get dehydrated, they will become more constipated. Other things you can do is add more fiber to the diet, either like adding psyllium husk, or if the cat will take it, something like canned pumpkin that has more fiber in it. And also looking again at giving probiotics.
Can we use liquid paraffin for the constipation?
Can we what for constipation?
Liquid paraffin.
I'm not getting that. Liquid.
Liquid paraffin.
Liquid
paraffin.
Paraffin?
Yes.
Okay, I'm not familiar with even what that is.
It's commonly used in India for constipation.
Oily preparation.
Yeah.
Okay.
So one more question is there.
And anemia solutions. You can use anemia or enema solutions in cats. It's better to just use warm water, maybe even with just a little bit of soap. There are other ones that have other, is it like phosphate or something, and that can get too much into the cat. So just warm water with just a little bit of soap is the best enema for cats. Okay, I see. So paraffin, yes, a mineral oil for cats. Yeah, that can. Usually it is better to give them more of a higher fiber diet, like I say, with psyllium husk, or add some pumpkin to it, or one that is produced that has more fiber in it. Okay, oral ulcers. That's not usually something we see with just primary GI diseases, unless if the cat is chewing on something toxic. then you need to obviously remove that, probably put them on an antibiotic to help with those ulcers, and probably get them on some pain medication. If they are not eating because of the painful ulcers in their mouth, then using an esophagostomy tube is going to be excellent. And then for allowing them to heal. Other causes of oral ulcers would be more like if they actually do have some severe dental disease and maybe need to have their teeth cleaned and some teeth pulled, or if they have some pretty severe kidney disease. They can get oral ulcers also.
Dr. Cheryl,
Yes.
usually it's very difficult to secure the cats. Is there any special devices or to control the cats while treating?
Okay.
Some special techniques or something like that?
Okay, treating within the clinic, or are you specifically saying for owners, for the owners to help treat?
Yeah, owner's house.
Okay, you know, if they can keep them in a small kennel so that they can catch them. Otherwise, as far as like if they need to give like oral medications, sometimes what we have here, we actually have what's called a cat bag, where it's a bag specifically with a zipper that you put all their legs in and just their head is exposed, which you can also do with a towel. If they wrap a towel around like the neck area and the body area and hold them closely within the towel, then just their head is exposed. And then for giving pills, there's actually like a pill pusher, almost like a pill gun that you use for cattle. They also make that for small animals to use.
That's nice. Thank you.
Yes. Or also, like I say, if they're able to get gabapentin in them, then that helps to kind of sedate and take the edge off of cats. That can be very useful.
Thank you.
You are welcome. Thank you for your question.
Okay, we have come to the, yeah, something is asking, question is there.
Dose of gabapentin. Usually for an average sized cat, we will use 100 milligrams. Again, if it's something that you know the cat's going to come into the clinic for and the owner is able to give, I'll have them give it the night before the exam and the morning of, like an hour or two before the exam. It can be sedating, so if that puts them out too much, then you can always decrease that dose. Again, thank you for all the kind comments.